Hello, good evening, dear friends. Myself, Dr. Mayank Bhatkoti from Haridwar, working as Associate Professor in Department of Panchakarma, Gurukul Kangdi, Haridwar. So, first of all, first of all, I welcome you all, Nepal Ayurved medical students, in this webinar series. So, you all know very well that today, before starting my talk, I pray to Almighty that in such a pandemic global situation, we must pray to God that give us strength to fight such a strangulating situation. Thank you. Now I will start my talk. My topic is role of Panchakarma in autoimmune disorders. So friends, this group of disorder which we know as autoimmune disorder, it is a very vast topic, and there are innumerable number of diseases which are included under this broad. Basically, what I want to say regarding this autoimmune disorders, that it is a group of disorders in which our immune system mistakenly act our body. So what happened in this disease? The body start to produce antibodies that are not good for our body, and this antibody acts like antigen, causing tremendous damage to the body. The various body parts which are mistaken as and are being affected, these are skin, joints, liver, and many others, including the muscles of the heart also. Okay, so many diseases are there, like SLE, systemic lupus erythematosus, psoriasis, rheumatoid arthritis, scleroderma, polymyositis, Hashimoto thyroiditis, and multiple sclerosis. So these are the innumerable diseases which are caused as an autoimmune disorder, which are common nowadays. It is very common disease nowadays. Their occurrence is very much. So sometimes a person may have two group of autoimmune disorder. We call it as a poly autoimmunity, or sometime he may have a multiple group of autoimmune disorder, which we call as multiple autoimmune syndrome. So there may be only two diseases also, or there may be multiple diseases. The same person may affect with only two disease or group of more than two disease. So with that we call multiple autoimmune system. So in some autoimmune diseases, the target is only one organ. Okay, so in one organ, it means it may affect only the muscles of the heart, that is called myocardium, causing what we call that myocarditis. Also, it may cause diabetes, or it may affect the whole body, causing SLE like syndromes, systemic lupus erythematosus, or rheumatoid arthritis, or psoriasis. So the presentation of this disease is like that. Presentation so presentation is like that. The disease, the presentation is like that. The disease may affect a single organ, or it may affect the whole body, what I want to say. So one organ is affecting, for example pancreas is affecting, then what will happen? It may cause diabetes or myocarditis, or it may affect the whole body, causing SLE, rheumatoid arthritis, or multiple, there are innumerable diseases, psoriasis. Okay, so when we say the age group, in which age group these types of autoimmune disorder we can see, it is almost varied. It can be seen in any age group, but most commonly it can be seen within the age group of 16 to 55 year. Mostly the patients will be affecting in this group 16 to 55. It doesn't mean that patient cannot be seen below the 16 year or after 55 years, but the most common age group is that is between 16 to 55 years. So this is a disease, this autoimmune disorder. It is a group of disorder in which the body start producing antibodies, and these antibodies just act like antigen and causing damage to the different types of organs in the body, single organ or whole body, or different approaches or different parts of the body. So now question arises, what is this immune system, how it is formed? So basically the immune system, it is called the host defense system. Basically it is host defense system. And what the basic part of this host defense system is, number one is WBC, most potent antibodies is there, lymphatic system is there, spleen is there, and the thymus gland producing T cell mediated immunity, and bone marrow cell producing B cell immunity. So these it whole makes the host defense system. Now what happens in autoimmune disease? This host defense system produce the antibodies which is not compatible to the body. It attacks the fresh cell of the body, producing different types of autoimmune disorder. So it is very important to identify. It is very important to identify the disease. In Ayurvedic concept, it has been described in different sites, in different chapters of our various texts. But what I think, this concept of autoimmune disorder is basically described in Grahani Chikitsa. This Grahani Chikitsa, that is Chikitsa 15th, Sutristan Charak Samhita. There, what he is saying, what has been described in Grahani Chikitsa, there is the concept of arm, the formation of arm. This formation of arm is responsible for a generation of innumerable diseases. So this arm is basically responsible for manifestation of different type of disease, which can be to the particular organ or to the whole body. This is very important. And how this arm is formed? This arm is basically formed due to the hypofunctioning of Agni. So, according to my opinion, the basic pathogenesis of this disease, autoimmune disorder, is classically seen in Grahani Chikitsa, where there is formation of arm, and this arm spreads to the different part of the body, manifesting different types of disorder. This is very important, and there the cause of this formation of arm has been classically described by Charak Samhita. What is there? There is the concept of formation of the basic cause are abhojanat, ajeen, ati bhojanat, visham asanat, asatmya, guru sheet, ati ruksha sandushnu bhojanat, vireko vamanam sneha vibраmat, vyadhi karshanat, देश काल ऋतु वैषम्यात वेगानाम च विधार्यात, दुष्यत अग्नि सदुष्टो अन्नम न पचति लघ्वपि, अपच्यमानम शुक्तव्यम यात्यन्नम विषरूपताम. So in this pathogenesis, which have been classically described in Grahani Chikitsa, the basic cause of this manifestation of arm formation have been classically explained. We have to think over these different types of causes which are responsible in formation of arm. That is, different types of abhojanat is there, that without eating, feeling improper eating, improper time eating, not taking proper quality of food, eating guru diet, cold diet, different types of disease or improper use of Panchakarma. There are different types of causes which have been described in this. What these different types of cause, what they are doing, they are leading to the hypofunctioning of Agni. And what this hypofunctioning of Agni do? It leads to the formation of arm. And what that arm do? It is formed, it is undigested part, it is not required by the body, it is formed, and it just act like poison. It reaches to different sites of the body, leading to the manifestation of different types of disorders. So this is the basic pathogenesis of autoimmune disorder, which according to my view, which have been classically described in Grahani Chikitsa. Now this arm reached to the joint, causing different types of connective tissue disorder. It reach to our coast or pancreas, leading to different types of autoimmune disorder, organ related autoimmune disorder. It reaches to the Kati-Parsh region, leading to different other rheumatoid arthritis like autoimmune disorder. This is the present in autoimmune disorder. So this arm is just history of the regarding the family history. Various research and statistical data shows that it commonly runs in the family. Sometimes it can be seen in one generation or one offspring, and sometimes it may not be seen in particular offspring. So it can be run in one generation, may not run in another generation. So the research shows that family history is very important in such type of disorders, autoimmune disorders. So the situation is that the antibodies are not able to identify the parts of the body. There is a question from Maharajan Jibit. Hello, sir. How to control the lungs infection? This is very important question. How to control the lungs infection in such type of disease? So it will come in the management part of this autoimmune disorders. Autoimmune disorder. When this ama formation is there and it reaches to the pranava srotas, it causes the different types of respiratory disorders. So our lung system become weak. So in that cases, in such type of cases, we can take the help of panchakarma therapy. Along with that panchakarma, rasayana therapy is also very helpful, and shaman therapy is also helpful. I will come in detail with that, what we call that panchakarma treatment. So in treatment, just coming to the treatment aspect of what we call that autoimmune disorder, because the question have been arises, there is a specific treatment protocol what we have to do. Again, the treatment protocol that has been classically described in context of amvad, what we call that langanam swedanam tiktam deepanani katuni cha virechanam स्नेहपानम वस्तिश्च आमवा वस्तिश्च आम मारुते सेंदवाद्यानुवासने चार वस्ति प्रशस्ते. This is the ideal treatment protocol of, I think ideal treatment protocol in maximum type of autoimmune disorder. So this treatment protocol can be also taken help for the treatment of what we call that lungs, different types of lungs infections. But we have to think over that the strength of the person, what we call that bal, is very important in management of this autoimmune disorder. If there is any sort of infection in the lungs, best treatment for that is what we call that langhanam. Fasting is very important. Fasting help in controlling the oxidative stress which is caused by the antibodies that leads or that acts like antigen. So the oxidative stress which is caused due to that antigen, it will be neutralized very much with the help of Langhan Chikitsa. So Langhan Chikitsa is very helpful in such type of disease. Number one, Langhan, and number two, Rasayana Chikitsa can play a very important role. We can use different types of rasayan, such as Pippali is very important in curing in taking care of the lungs infection. Now next question is from Naresh Itani. Is it only the arm leading cause of autoimmune disorder? How we can cure IBS completely from Ayurvedic perspective? So IBS is also one of the important autoimmune disorder. Arm is one of the leading cause of this autoimmune disorder. And you see, I have previously told in my talk that this arm is formed at both endogenous level and exogenous level, or at localized arm or at generalized arm. When this arm is formed in context of localized or endogenous level, then how is it formed? How it is formed? In exogenous level, we are taking some incompatible dietic articles. There is leading to the formation of arm. In endogenous formation of arm, what is happening? All the three, those, when they are not in proper manner, what they are going, they are intermixed. They are intermixed in such a permutation and combination. Then what they form endogenous formation of arm. So in IBS like disease, it is also autoimmune disease caused by the question asked by Mr. Naresh Itani. In such type of disorder, Arm is also important. So Langan Chikitsa is very important. Fasting is very important. Langan Chikitsa is very important in treatment of disease. In IBS, the Parpati Kalp is very important. The Parpati Kalp is very important. We can use the Parpati Kalp in Ras Parpati using the buttermilk in increasing form, then in static form, and then in decreasing form. Perpetic culp is very important. There are various drugs which we can use for IBS. And what I want to say that when we think over the role of what we call that Panchakarma in management of this type of autoimmune disorder, considering on IBS, then Pichavasti is very important. Role of Vasti is very important. We can use Pichavasti. So Pichavasti has been classically described by Acharya Charak in various stages, in various contexts. Pichavasti has been described. So we can take the help of Vasti therapy. Vasti therapy is very important. Role of Nidan Parivarjan is very important. The various Nidan which have been described in Grihani Chikitsa, that is Viruddha Ahar, not following the specific dietetic rules, avoiding the caffeine, alcohol, sugar, all these things. Okay, so it will help in making the cure of that disease. So Langan, along with Langan, Vasti Chikitsa and Nidana Parivarjan is very important in curing the IBS, which is again one of the important autoimmune disorder, and the cause is what we call that Viruddhar and all these things. So Rasayana Chikitsa can be also. Next question is from Dr. Suman Khannal. Sir, the treatment principle of autoimmune thyroid disorder can be Dhatwagni Mande treatment. I think the treatment protocol is yes. Nowadays the treatment protocol is using it is more symptomatic, but in such type of thyroid disorder, autoimmune, that what we call that Hashimoto's disease, autoimmune thyroiditis, autoimmune disorders, role of Panchakarma here play a very important role, because this or Hashimoto thyroiditis, it is a Dhatwagni Mandijan. So the treatment protocol must be that it must stimulate the production of fresh dhatu, not improper dhatu, so that all the dhatu can be attained properly. Here the role of Vaman Chikitsa is very important. Here we are using the Vaman treatment protocol, treatment using Vaman therapy. It helps a lot to the patient. It help a lot to the patient of this autoimmune thyroiditis. And after this Vaman, there should be a schedule of Virechan Karma also. Virechan Karma also. Virechan Karma can be used for the treatment of this autoimmune thyroiditis. According to my personal view, a combination of Rasayana Churna, that is Gokshur, Guduchi, Amalki, it will help in maintaining the various type of this thyroid disorders. So a combination of Gokshur Churn, Guduchi Churn and Amalki Churn, it will help a lot in managing what we call that, it will help a lot in managing this autoimmune thyroiditis. So in thyroid there are a lot of treatment approach, but combination of Vaman followed by Virechan along with the drugs which are beneficial for a Ras Dhatu, which will help in formation of fresh Ras Dhatu, so that Dhatu Agni Daurabalya should not take place. Again here the role of arm is very important. This arm, okay, so this arm formation, which the formation of arm which we see, it just act like a free radical concept. You all know it very well. Free radical concept. So what at all is happening there? A free electron is being created, which which persuades the fresh cell to be neutralize its free electron. The atom persuades the fresh cell to neutralize the free electron, and in this way it is not able to identify the whether this is the fresh cell or it is a damaged tissue. So it again attack the fresh cell, leading to the multiple damage to the body, leading to the various type of autoimmune disorders. So how this, what this autoimmune disorder do? This autoimmune disorder, what it will do? It will cause the destruction of, it will cause the destruction of the body tissue. It can cause the abnormal growth of an organ, or what can it do? It can again change the organ function. It can again change the organ function. So it will act in three directions. It may cause the destruction of the body tissue, or it may form the abnormal growth, or it may alter the function of the organ, which it must not do. It is very important. So the concept of free radical is also very important. And here the rasayan therapy is very important. There are ample amount of rasayan churn. When we think about rasayan therapy, this rasayan therapy helps in managing the dhattvagni also. The rasayan that can be related to the particular dhatu. For example, rasayan related to ras dhatu, rasayan related to rakt dhatu, rasayan related to mans dhatu, rasayan related to med dhatu, asthi dhatu, majja dhatu. So each and every dhatu has a particular drug which act as a rasayan for that dhatu. So we can use this type of rasayan in neutralizing the arm, so as to avoid the oxidative stress which have been created by the formation of the unpaired electron of the atom, or what we call that molecule. Although the exact cause of autoimmune disorder is not even known yet. So Ayurveda has the ample opportunity to explore the cause of this autoimmune disorders. There are various theories to demonstrate the cause of this autoimmune disorder. For example, genetic susceptibility there, superantigen theory is there. Food allergies have been also explained. That food allergy in context of Viruddha Ahar, 18 types of Viruddha Ahar that has been described in Ayurveda. It is very important. That has been described in Charak Samhita, Viruddha Ahar. And dietic rule is also very important. How you are taking that food, what are the rules for taking your food articles. Okay, and sometimes the various type of infection, viral infection and bacterial infection, may also precipitate the autoimmune disorders. And psychological factor is also very important in manifestation of such this autoimmune disorders. A role of stress is very important. There are various studies which shows that that the person who has stress, who is suffering from stress, is more potent to have the incidence of autoimmune disorders. Previous researches or previous statistical and data shows that the persons who are susceptible to stress, they are more prone to have this, what we call that autoimmune autoimmune disorder. So this concept is also very important. Now there are in modern there are some investigations, general investigation, which we see, which we must have to carry out regarding this autoimmune disorders. These are routine blood count is there, CRP is there, and what one important investigation which I think it is very positive, that is ESR, that is erythrocyte sedimentation rate. But it must be also, it will always be increased, but it must be taken into consideration that if there is severe anemia, and that's patient suffering from severe anemia is having autoimmune disorder, he will not show elevated ESR. Of course, it is due to the, because anemia, due to the anemia he will not having increased ESR. And nowadays a latest investigation is that is called auto antibody test, but we call that anti-nuclear antibodies. So they are identifying the antibodies which are going to act like antigen and causing destruction of this this body tissues, various body tissues. So it is very important. Coming to the generalized symptomatology of the autoimmune disorder, it is very important to recall what may be the general symptomatology of the autoimmune disorder. What I think the general symptomatology of the autoimmune disorder has been classically described in Amavat. What is explained there, that is Angamarad Aruchitrashna Harilas Gauravam Jaram Apakam Shunyata Anganam Amavatasya Lakshanam. Although this symptomatology have been described in context of Amvat, and you see there in that disease Amvat, the major factor is Am. It is going to destroy the different body part, especially the connective tissue leading this Amvat. And these symptomatology can be seen in terms of fatigue, aching muscles, swellings, and redness. There will be the low-grade fever, always. There will be the low-grade fever. There will be the trouble in concentrating. There may be the numbness and tingling sensation in hand and feet. Okay, there may be the skin rashes. This symptomatology is generalized symptomatology, or organ-related or particular organ-related autoimmune disorder may have that particular symptomatology. So we have to think over this. We have to analyze the general symptoms. We have to assess these symptoms. Okay. Now coming to the treatment aspect of this autoimmune disorders. Autoimmune disorder. First, Nidana Parivarjan is there. The first Nidana Parivarjan. You must know what you have to take and what you have not to take. So Viruddhahar concept is very important, which I have told you previously. One question was there, Viruddha Ahar. Specific dietary rules are there. Okay, so we should suggest the patient to have a fresh food, seasonal vegetables are also there. These are also very important. Avoid the use of Western diet. Western diet is very rich in fat. It is having high sugar. It comprises of processed food. So it will help to set an immune response. It will help to set an immune response. So again, it will create an immune response. So it will further deteriorate the body in various forms. So it is very important to avoid the Western diet, which is not at all appreciated here. So role of vitamin A and vitamin D is very important for having better immunological function and calming the immune system, lowering the inflammation. and for better functioning of immunological function. So in modern they are using immunosuppressant drugs in this diseases. So we have to use this type of concept very importantly. Along with this, adequate sleep, ample amount of sleep is also very important. We see that in such type of disease the patient is already under stress. It may it may it may create a problem to the patient. He is over stressed, and this stress make a circle, make a rhythm, and aggravates the symptomatology of this disease through which he is suffering. So adequate ample amount of sleep is very important. You see, the a symptom that is nidra viparya is also seen in is also nidra viparya is also seen in what we call that auto amvat. So proper ample amount of sleep is also very important for ample is very ample sleep is very important for the disease for the disease. Also, the step should be taken to avoid this infection, because the body is such that the immune system is compromised. The patient is prone to have various type of secondary infection. So steps should be taken to avoid the infections or secondary infections. So patient must be treated, he must be guided to avoid the such type of infection, and a proper treatment column of Panchakarma should have to be followed. So Panchakarma has a potent role in management of this disease. First of all, Langan is very important. We can use the treatment of Swedan also. Swedan can be in the form of Snigdha Swed or a Ruksh Swed, depending on the severity of the disease, depending on the nature of the disease. For example, if an autoimmune disorder is of connective tissue disorder involving the connective tissue, and it is causing the inflammation, redness, pain, so what we can do there, we can use the Ruksha type of Swed is there, that has been classically described in our Samhitas. Before carrying this Panchakarma therapy, a simple coast should be done to the patients. Simple coast should be done. For that, we can perform a simple Salavanavasti or simple Salavanavasti. We can use the Salavanavasti, or we can give some purgative drugs in form of arand tail, so as to avoid the disease. So Langan is important. Swedan is also very important, and after that Swedan, Snehan is Abhyantar Snehapan is also very important, so as to have a better response to the body. So, and after that, Langan and Swedan, where the role of Virachan is very important. So, dear viewers, if you have any queries, you can ask. You can feel free to ask the question. So Virachan, what we are doing in Virachan, we are giving Amapachan drug so as to have the Amapachan. After that Amapachan, we can give the Abhyantar Snehapan in increasing dose Snehapan up to Samyak Sneha Lakshan. So we can give that Sneha, and after that Virachan can be given to the patient. So in such type of cases, Virichin, there are ample amount of drugs available which we can use for Virichin karm. Virichin Virichin karm. Virichin karm. For example, Tifla. So there was a bit connectivity problem, so again we are there. So we can use the different types of drugs for Virichin karm, that is castor oil, trifla churn, trivrat churn, sometimes avipattikar can be churn. So different types of combination, ichha bedi ras, castor oil, abhiyadi modak. There are a lot of drugs which we use for the there are a lot of drugs which we use for the Virichin karm. So Virichin karm is very important, can play a major role, because what will it do? Pitte tu virikam slesma sansrashte Vatatisthan gite. The Virichin has very broad role in management of this disease. So Virichin can play a very important role in managing this disease. So friends, after Virichin, we can also use Vaman Karma for management of autoimmune disorder. For example, if a disease is psoriasis, in a disease like psoriasis, what we can do? We can use, we can, in psoriasis. So if there are any queries or if there are any questions regarding this, I will request to all my viewers to have questions on this. Regarding the questions, if there are any queries, the queries are welcome from all the viewers. One question is that whether Panchakarma can play an important role in this from psoriasis. Yes, Panchakarma has a major role in management of this psoriasis. We can use Vaman followed by Virichin. After that Virichin karm, what we can use in psoriasis, Takrdhara, because this psoriasis is again a autoimmune disorder. Along with this autoimmune disorder, it is involving a psychosomatic aspect. I am not able to get the. Yeah. So the question from Hemanta Gautam is there: is there any relationship between IBS and Grahani? Yeah, it is very important question. That whether there is any relation between IBS and Grahani? Yes, of course. IBS, the pathogenesis of IBS is almost very much related to the Grahani. Grahani is a very vast subject. It is not a single disease. It is a syndrome. It is involving the various symptomatology which we see in form of different types of diseases of GIT, such as celiac disease, IBS, ulcerative colitis. So all these disorders which have been classically described in modern medicine, they can be included under the broad heading of that um, Grahani. Now there is a, yes, of course, IBS can be summarized under the umbrella of Grahani, and the treatment protocol of Grahani, that is not a single treatment. It has a broader treatment. It can be applied for the treatment of that IBS. Another question is from Dr. Suman. Sir, can we identify can we identify risk factor based on prakriti, days, etc. for autoimmune disorder as per Ayurveda? This is very important question. That can we identify the risk factor based on, to identify what can be the risk factor for a particular person to have a this autoimmune disorders. Each and every person may have a different risk factor for precipitating this autoimmune diseases. चरक संहिता says that समीक्षा में दोष देश भैषज काल सात्म सत्म, so these are approximately 11 points. We have to examine all these things properly before indulging in the treatment protocols. Although it is very difficult to analyze or examine all these factors simultaneously at a time, and a wise doctor will also be confused in examining all these things at a time. So it is very important to analyze or to examine these prerequisite points. These are the prerequisites which we have to examine before indulging in any type of chikitsa. So prakriti will help in identifying the risk factor. It will help in identifying all, of course it will help in identifying that what can be the cause of disease, cause of autoimmune disorder in manifestation to a particular person, because the three dosh have been, doshik prakriti has been classically described, and the vata prakriti patient is more susceptible to have a vatic disorder, and pitta prakriti patient person will be more prone to have a pitta predominant and disorders. In the similar fashion, in the similar way, a kapha prakriti patient is can be more prominent to have a kapha disorder. So the disease, autoimmune disease, which is in accordance to doshic level, we have to examine that, and in that term we can assess the risk factor for that patients. Now there is another question from Saroj Mani Pokhrel ji. What actually are dosh in the point of view of Panchakarma? Example, it is said that kaph is eliminated through Vaman, or what actually is kaph and eliminated after Vaman in the viewpoint of the body? This is very important question, that what is the dose, concept of dose in relation to the Panchakarma. So when we talk about Panchakarma, there have been specifically some techniques to identify that which type of shuddhi is there. For example, there are basically 4 types of shuddhi. Vegaki shuddhi, in which we counts the number of veg. Manaki shuddhi, in which we counts the amount of the expelled vomitus, measure the amount of the weight of the vomitus. Manaki shuddhi, weight of the weight of the vomitus. And at last the important one is that Laingiki shuddhi, or the shuddhi which is assessed on the basis of symptoms which patient feels after the shuddhi karma, vaman karma. So we can assess this dosh, kapha dosh or vata dosh or pitta dosh, in terms after the process of Panchakarma has been finished, whether the aggravated condition of that dosh is being lowered or not. So it is there. It can be assessed through the Laingiki shuddhi. The shuddhi, the dose assessed on the basis of the which can be seen in the patient before the Panchakarma and after the Panchakarma. So your question can be directly correlated to the Laingiki shuddhi, to the Langeki Shuddhi. Now another question is that is now another question is that whether there can be any complication of Panchakarma in autoimmune disorder. Yes, of course. When we are when we focus on the pathogenesis of the grahini, there it is already described that if we are not properly following the Panchakarma protocol, Vamano Virecho Vibramat, if you are not carrying proper Panchakarma, then it may cause the formation of arm. It may help in the formation of arm. So leading to the cause of that again various type of autoimmune. If the Panchakarma treatment protocol is not being uh, where the treatment protocol is not being followed properly, it may again manifest. It may again be seen as the cause of these particular disorders. Now another question I can see from Anamika Subkota, can all disease where arm is formed can be related with autoimmune disorder? It is very important question. It is not like that. Then each and every cases where there is the formation of arm can be correlated to the autoimmune disorders. This formation of, I have told you, I have talked about this formation of arm. If it is a localized arm or it is formed for the shorter duration of time and it is treated in the proper time, then it will not cause any problem. But arm is one of the important factor that is responsible, that is very important causative factor for the autoimmune disorder. So not all the conditions where there is the formation of arm can be a autoimmune disorder. It is very clear. Sometimes it is like that it is like that the formation of shorter duration, we can simply Pachan, Langhan, Deepan, and the arm can be formed. Sometimes there may be the formation of acute arm or chronic arm. In form of acute arm, that is Visuchika, Alsak, Vilambika have been described. So there is each and every time when there is formation of arm, it cannot be a autoimmune disorder. I doesn't want to convey through this talk that each and every cases where there is formation of arm, there will be the autoimmune disorder. Yeah, but arm is one of the important factor along with other that help in manifestation of autoimmune disorders. Then another question is from Himanta Gautam. Can Rakta Pitta also be considered as arm doshad vyadi? Rakta Pitta is again a question. Rakta Pitta Vyadi is a purely a Vyadi in which only two dosh are involved, that is Rakt and Pitta. So there is least consideration that ama formation is there. Okay, here you see there are three dosh: Vat, Pitta, and Kapha, and their permutation and combination is in such a way that they can manifest enormous disease. We cannot count them. There are disease infinite. So their combination can be is such that they can lead to the formation of multiple disease. So in a Rakt Pitta, there is least possibility. I think there is the least possibility of the formation of arm. There can be the only two dosh. That is, one is Rakt and Pitta. These are intermixed in different. These are intermixed and they vitiate each other in form of Dravatva and Gunatva and cause the manifestation of this disease. So I think Hemanta ji, your question would have been clear. So it is not at all like that. In each and every cases, arm is responsible for this disease. No, now I can see. Uh, there is a question from Kiran Lamsal. Sir, what could be the possible panchakarma for the treatment of respiratory disorders, because they are almost contraindicated? Yes, it is very important questions. So what I want to convey, that I think I am of firm opinion that you must know where not to do panchakarma. I am very glad that you are careful, Kiranji, that we have to avoid panchkarma. So in cases where where there is least possibility of panchkarma, if there is his lung is weak, there are ample amount of secondary infection, it is never necessary to use your panchakarma therapies, and especially the pradhan karma, Vaman, Virechan. These are because it increases the intra-abdominal pressures, and along with that intra-abdominal pressures, intrathoracic pressure, and it may precipitate the disease. So there can be the different treatment modalities. There can be different treatment modalities. We can use the rasayana treatment. There are the particular drugs which are rasayana to the pranavasrotas drug can be used there, and along with that langhan and balya aushadhi can be beneficial to the patients where there is where there is respiratory disorder. For example, what we call that pipple is a very important, and culp of pipple can be very important. And in respiratory disease, if we have to use the panchakarma therapy, then we can use the purva karma in different forms. For example, we can use swedan, sandhav yukt, Snehan, and Swedan. We can use it, can be very beneficial, and it has been classically described when we study about the Shwasa Rog. There, the Sandhav Yukt Sneha can be used for the treatment. Okay, so this is the one of the important question which we have take into the account regarding the autoimmune disorders. So, I am of the we should also think over that the Agni have to be understand under the three broad headings: Jatharagni, Dhatwagni, and Bhutagni. So when we are considering about when we are considering this autoimmune disorder, there in primary stage there will be the Jatharagni mand, and in later stages this Jataragniman will precipitate the Dhatwagniman, leading to the improper formation of Dhatu, which will which will manifest different types of disorders, uh, different types of order. So in that way, in nutshell, what we can say that the different types of dieting, different types of ahar, different types of dietic rule which we have to follow, that we have to follow a healthy lifestyle, we have to avoid the western diet, we have to avoid the cause through which this is responsible. We have to use the there is a we have to we have to we have to use the use of rasayan. There are enormous number of drugs which can be used. For example, giloy is very important, chopchini is very important, makoy is very important, gokshur is very important, amalki is very important, shilajatu is very important. These are the different types of drugs which we can see help in help in help in treatment of the dhatwagni at different dhatu level. So one question, last question we can take. What about Vasti in respiratory disease? In these diseases, what is main factor, and Vasti could do something good for respiratory diseases? It is the last question which I would be. Uh, yeah, basic dosh that is responsible in respiratory disease in terms of that autoimmune disorders of lungs, or that can be included under the broad heading of Schwas. That is that a Pitta and Kapha dosh are important. That is the disease having pathogenesis is Pitta Sthana Samudvaya, and the dosh specific involved is cough. So Vasti, I think Vasti cannot be such important in respiratory disorders. Better if the strength of the patient is okay, if his lung functional capacity of the lung is, we can go for yeah, we can go for a woman, or in that cases we can go for woman or Virechan karma. So Vasti cannot be I think Vasti cannot be beneficial in such type of courses. So we are short of time. So I thank to all my viewers, the the group of students of Nepal, and I am very much thankful to the Lochanji, and also for arranging such a nice webinar series. And of course, we are very grateful to the all my viewers. And I think I have taken a lot of questions, and I tried my best to clear the doubts. And at last, I thanks to all my viewers, including what we call the students of Nepal. Also, I want to thank Ayush Darpan Foundation, which is working a lot in uh, the benefit of Ayurveda fraternity. Thank you all.